Which PSA test is better for prostate cancer screening? Imagine catching prostate cancer early before it causes serious problems. That's where the prostate-specific antigen test comes in. It's the main tool doctors use to check for prostate issues, including cancer. But not all PSA tests are the same, and choosing the right one depends on your personal risk and health. The most common test is the total PSA blood test. It measures the overall amount of PSA protein in your blood. Higher levels can suggest prostate cancer, but they can also be caused by benign conditions like enlarged prostate or inflammation. Usually, a PSA level below 2.5 or 4.0 nanograms per milliliter is considered normal, depending on your age. However, some men with prostate cancer may have normal PSA levels, and elevated levels don't always mean cancer. So, the total PSA test is a good starting point but isn't perfect by itself. To improve accuracy, doctors often look at the percentage of free PSA in your blood. PSA exists in two forms, free and bound to other proteins. When the free PSA percentage is low, typically 10% or less, it suggests a higher chance of prostate cancer. If it's between 10 and 25%, your doctor might consider additional tests or a biopsy based on other factors. This helps distinguish between benign conditions and cancer more effectively. There's also the complex PSA test, which measures the PSA bound to proteins. While it provides similar information, it's less commonly used today because combining different forms of PSA gives a clearer picture. More advanced options include the Prostate Health Index and the 4K score test. The Prostate Health Index combines total PSA, free PSA, and a precursor called pro-PSA to give a score that predicts the likelihood of significant prostate cancer. The 4K score uses for different PSA markers along with clinical information to estimate the risk of aggressive cancer. These tests aim to reduce unnecessary biopsies and focus on detecting cancers that need treatment. In addition to blood tests, a digital rectal exam is often performed. This involves a doctor feeling the prostate through the rectum to find any abnormalities. Using both PSA testing and digital rectal exam together provides a more complete screening approach. It's important to remember that PSA testing has limitations. False positives can lead to unnecessary biopsies and anxiety, while false negatives might miss some cancers. Large studies show that PSA screening can reduce deaths from prostate cancer but also risks overdiagnosis and overtreatment. That's why personalized screening, based on your age, family history, and overall health, is essential. Ultimately, the best PSA test for you depends on your individual situation. Your healthcare provider can help decide whether a simple total PSA test, a combined PSA test, or a more advanced marker is right for you. They'll consider your risk factors and guide you through the screening process to ensure it's safe and effective. Always consult with a healthcare professional to make the most informed decision about prostate cancer screening tailored to your needs.